Welcome back. Looking and feeling your best is why so many have turned to plastic surgery. The what ifs definitely crossed your mind, right? Your safety is top priority, and that's why in today's Trusted Advisor segment, Plastic Surgery Associates wants to ease your mind about breast implant-associated illness and recent concerns over the COVID vaccine and how it affects facial fillers.
So I'm Doug Vander Woude. I'm one of the plastic surgeons here at Plastic Surgery Associates. I've been here for over 20 years. So breast implant associated illnesses are a little bit of a hot topic right now. It's kind of been gaining ground in terms of number of people talking about it, things like that. And it's gotten to the point where it's really heating up in the social media world. It is, however, a difficult topic to really get your arms around because it doesn't really have any clear boundaries. It's basically a collection of people, I guess you would say, who have breast implants, and they have a variety of symptoms that they think may be related to their implants. But the symptoms reported are a wide range of symptoms, and they're not real specific symptoms. I mean, there are people that have some soreness related to the implant itself. That does occasionally happen, but the vast majority of people who are in this group and that are talking about this are talking about things like tiredness, sleep disturbance, headaches, joint aches, muscle fatigue, things like that. There's always been a low-level concern that there could be some problem with silicone implants and effect on the immune system, things like that. No scientific study has ever shown that to be the case, and implants have been around since the 1970s. This isn't like a new thing that we're experiencing here. So, I guess it remains to be seen exactly what is going on with this new collection of people who are talking about it, if it's a real thing. I mean, there are studies that have started now through our aesthetic society has been pretty much spearheading this in terms of looking at it from a scientific point of view, looking at people who have had symptoms, had their implants removed, to see if how many of those people get better, is their improvement sustained. Breast implant associated ALCL is a real, actual, definable problem. It is a process where a certain type of implant causes a low-level inflammation around the implant, and over time that can actually even develop into a cancer, and that's what the ALCL part is. That diagnosis has been around for a few years, but now it's quite clear that it's specifically related to certain implants with a textured surface. So implants traditionally have come in different versions. Some of them have a smooth silicone rubber surface on the outside, and some of them had a textured surface, almost like a super fine, almost like a velour kind of surface, so that the implants won't move around, which is important if you have, for example, like a teardrop shaped implant. It's, thicker on one side, thinner on the other side. You want it to stay in position. You don't want it to go sideways. So they had a textured surface. Well, those implants in particular are associated with this problem. It's still a rare problem if you have those kind of implants, but if you have smooth implants, which the vast majority of people do, you are essentially no risk for that problem. So those textured implants have now been taken off the market. They're not available. The issue is facial fillers specifically. So now we're not talking about Botox, which is different. That stops muscle from moving and helps with your wrinkles. What we're talking about are facial fillers, which are compounds that we put into the tissue to add volume. And a common place to put them would be in the lips or in these lines on either side of the mouth, that sort of thing. So those are facial fillers. Been around for many years, very safe. Those have had a possible association with the COVID vaccine, and that's been kind of the news item, I guess you would say. A few people that have had the COVID vaccine, very few people that have had the COVID vaccine have had swelling in their lips, for example. There's been some suspicion that maybe it's because they had fillers, but that's really not well documented. It has not been a major health issue for them. Nobody's been in the hospital or anything like that. It's been a fairly relatively small problem, I guess you would say, and it's been a very small number of people, on the order of 3 in the entire country, so it's quite rare. When you think of plastic surgery or cosmetic surgery, you think of all those cosmetic operations, and we do all of those operations here. Breast augmentation, as we mentioned before, with implants, tummy tucks, facelifts, rhinoplasty, which is the nose, eyelid lifts, liposuction, all those things we do. And those are popular procedures. They're very safe and have been going on for many years here. But there's a whole nother side to the world of plastic surgery. We also do reconstructive procedures in plastic surgery as well. People who have had breast cancer, people who have skin cancer problems, people who have been accidents or injuries, scars, things like that. And those things generally fall under more the traditional side of medicine. Those are actually medical problems, and they are covered by medical insurance by and large. Plastic surgery's been going on a long time now. It's, a couple generations, I guess you would say, right? And this practice even been here over 30 years. I mean, we've had 60,000 procedures or something like that. I guess I can't remember right off the top of my head, but it's a large number anyway. And our rate of problems is extremely low. So you couldn't find a better place to have an operation, and it's a lot more private and a lot more attentive than a hospital setting, for example. So great place to be. If you have questions, the thing to do is come and talk to us. I mean, basically a standard consultation is the scenario you'd find yourself in. It would be, the patient and doctor one-on-one talking about what you're concerned about. We could tell you what your options are. You can find out about what things cost and, what the recovery is like, all those kind of things. And a lot of that, you're not going to be able to find all of that online. You'll be able to educate yourself somewhat online to get a general idea what these things are involved in, but until you know specifically what's recommended for you, you don't really know, what you're dealing with. So we do encourage you to come on in and go over it. And obviously there's no obligation. You just, learn about it and go from there.
And Plastic Surgery Associates is located in the Amway Grand Plaza Hotel in downtown Grand Rapids. For more information, you can visit their website at psa-gr.com or give them a call, 616-451-4500.